Hello, my name is Kayla Hamilton, and today I will be presenting my experience with the fracture of the navicular. So right here, I have a bit of an outline of my case. So I am a female. My current age is 20 years old. I was born in 2004. The year of my initial injury was fall of 2014, and my age of the initial injury was 10. I believe that the injury did happen when I was playing basketball outside, but I'm still not for sure how it did happen. I was eventually diagnosed with an ununited avulsion fracture of the dorsal navicular, and I got this diagnosis from a sports medicine physician located in Collingwood, Ontario. My pain course is 3 years following my initial injury, which is quite long. This is just because every single doctor that I saw in Sudbury told me that the pain was just from growing. And finally, after 2 years after the injury, they found something. And I saw an orthopedic surgeon in Sudbury, and he told me it was healed and that there was nothing that they could do. After seeing the sports medicine physician located in Collingwood, he did tell me that there was something to do, and he referred me to an orthopedic surgeon at Sick Kids Hospital, and that is where I got my surgery. This is an actual x-ray of my foot at Sick Kids Hospital, and they showed me where the bone was fractured. So a bit of my background knowledge, I knew that it was associated with specific movements and sports. I also know that it's most common in young athletes or just athletes, and it can be fairly difficult to identify from my own personal experience. The main population, like I said, is athletes, specifically running athletes. This can be track and field or cross country, anything like that. There's also a high risk in activities with repetitive jumping, so football, basketball, there's soccer, and it's seen more commonly in females. One study that I did find was a study of NFL athletes with navicular fractures, and there was a finding between 2009 and 2014 that only 0.6% of them sustained injuries to their navicular. Another statistic that I did find is that up to 32% of fractures are related to navicular fractures in the foot. A fracture like mine is considered rare to the general public, but looking at a population of athletes, it can be pretty common. Some risk factors to note is that the navicular is already susceptible to stress fractures, and they have very delayed healing times. Some other things that can contribute are your sex, patient's anatomy, poor nutrition, and repetitive impact. Also, if you have a decreased ability for plantar flexion or forefoot abduction, this can also heighten your risk for this type of fracture. So again, I believe this did happen when I was playing basketball outside. Most likely when I was going to run and retrieve a ball. Afterwards, I got an odd aching pain. It went away and then came back about a month later. Some symptoms that I had was a dull aching pain at rest, specifically after doing an activity, sharp pain in my midfoot while walking or sprinting daily, and then I had a constant limp that everyone noticed. It affected my knee joints, my hips, and my lower back. After getting a physical examination from a physiotherapist, they discovered that I had limited dorsiflexion and plantar flexion in the right foot. It was extremely painful when completing inversion and plantar flexion. I had, again, a constant limp and noticeable hip and knee instability on my right leg. I got ultrasounds, CT scans, MRIs, and x-rays numerous times. I can't even remember how many. Next is my diagnosis part 2 history. I've been playing basketball since I was in grade 2. Then the fracture did happen when I was about in grade 5 to grade 6. I continued to play during that whole time again because the doctors told me that I was fine. And then finally at the end of grade 8 is when I got my surgery, which I wasn't playing basketball at that time, but I did continue playing in grade 9. So for management, in the control section, I have 6 weeks no weight bearing for non-operative cases, gradually put into a boot for 2 to 6 weeks after there is no pain. Then if we're talking about surgical cases, no weight bearing for 6 weeks in a boot after the surgery, and an additional 2 to 3 weeks walking pain-free. And then crutches and boots are required for all healing processes. For treatment, again, non-weight bearing, obviously, and then for serious cases, there is a need for surgical intervention. It is all kind of dependent on the severity of the fracture. Sometimes there is an open reduction interval fixation that is needed during surgical procedures. For promoting healing, I personally just sought physiotherapy, but I also found that vitamin D supplements are really good for bone and reabsorption. Also, shockwave therapy has been proven to help, and of course, splint and boots worn for proper healing. For increasing fitness, it is really important to focus on conditioning, range of motion, gait exercises. All of these are really crucial for making sure that a patient is not susceptible for another injury. Some examples for the ankle include alphabet exercise, resisted flexion and dorsiflexion, toe raises, and heel raises. For me, for correcting abusing factors, we really worked on gait with my physiotherapist, properly walking my hips and knees in the proper positions, strengthening all of the muscles and ligaments around the ankle joint, strengthening my legs, core, everything to help stabilize my lower extremities. And I was always mindful after that while playing sports, and I did tape my ankle for a little bit as well. Luckily, in my case, I did have a full recovery. I've been about 6 years now pain-free, but I did also list some other possible outcomes. So there is a partial recovery, a non-union, and then there's obviously surgical risks like infection, deep vein thrombosis, and osteoarthritis. And that's all for my presentation. Thank you so much for listening. I have attached my resources at the end for you guys to see. Thank you.